Evening, Mr. Smith. My name is Shannon Smith. You can call me Shannon. I'll be your nurse practitioner today doing your exam. Just gonna wash my hands before we get started. Do you have any questions for me?
No.
Alright, I'm gonna just note your general overall appearance, your facial expressions, any facial asymmetry, your mood, your affect, your hygiene and nourishment, and your body position before we get started. So we're gonna start with the neuro exam. I'm gonna ask you a series of questions. Can you tell me where you are today?
In the house.
Okay. Can you tell me the day of the week,
Friday,
the month,
March
and the year?
2017.
Who's the President of the United States?
Donald Trump.
Okay. I'm gonna start with recent memory. What time was your appointment today?
8 o'clock.
Okay, remote memory. What did you do for your last birthday?
Dinner with friends.
Okay, cervation is next. I'm gonna have you spell world backwards for me.
Okay. DLROW.
Okay, and then I'm gonna ask you a question for reasoning. How are apples and oranges alike?
They are both fruit.
Okay, I'm gonna have you do some tests for me then. Can you place your hands on your knees? I'm just gonna have you move them back and forth really quick. Good. And then I'm gonna have you touch each finger to your thumb and do that as quick as you can. Excellent. Next, I'm gonna have you touch my finger with your finger and then go ahead and touch your nose. Okay, go ahead and do it with the other hand. And at this time, your movements seem smooth. I didn't notice any intention tremors. And I'm watching your hands at rest, and it seems like they're also calm, and I don't notice any resting tremors. I'm going to have you then take your right heel and move it down your left shin, and repeat on the other side. Excellent. We are next going to test your reflexes. I'm going to have you just kind of relax your arms here. We're going to test your brachial reflex. Good. I'm going to test your tibial reflex. Your brachioradialis. Good. Your patella reflex. Your Achilles reflex. And I'm gonna test the Babinski side. Just relax your foot. Next, we're gonna do some sensation. I'm gonna start by we're gonna do sharp and dull sensation. This is what sharp feels like. This is what dull feels like. If you close your eyes. Okay. Tell me if that's sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull.
Next, I'm gonna just have you tell me with your eyes closed again if you can feel this.
Yes. 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 Yes.
Have you open your hands for me? I'm gonna place some objects in your hand, and I'm just gonna have you tell me again with your eyes closed what object that feels like to you.
It's a key.
Good.
It's a pen.
Good. We're gonna next test vibration sense. Again, with your eyes closed, and have you tell me what you're feeling.
It's a vibration.
Okay, tell me when you stop feeling that.
It's gone.
Can you feel that?
Yes. It's a vibration. It's gone. I can feel that. It's vibration. It stopped. I can feel it. It's a vibration. It stopped. I can feel it.
Okay. last thing I'm gonna do, I'm just gonna have you again keep your eyes closed. I'm gonna test proprioception. I'm just gonna have you tell me what direction I'm moving your finger.
Up. Down.
And your toes.
Down. Up.
Okay, good. I'm gonna have you take your shirt off for the next part of the exam. Okay. I'm gonna take a look at your upper body. I'm gonna look at the skin color. Just relax here. I'm gonna feel the skin temperature. Note for any edema. I'm gonna check for scars and lesions. You do have a scar there. I'm going to check your cap refill on all your fingers. And I'm just gonna test your arm tone and kind of the bulk of your extremities here. I'm going to start by inspecting your spine, noting the contour and shape of your spine, any areas of swelling or redness. I'm going to then palpate your spine, starting with your cervical spine. I'm going to test your cervical facets and the bony prominences with my thumb here, noting any step-offs or areas of pain. Does that hurt at all?
No.
Let me know if any of that hurts. Okay, and I'm going to palpate your sacroiliac joint here, your paravertebral muscles and your sits muscles. Does any of that hurt?
No.
I'm feeling for crepitus or areas of warmth or bogginess and fasciculations. And then I'm going to test for CVA tenderness. So I'm going to just pound on your back here and tell me if this hurts.
No. No.
Okay. I'm going to start by then inspecting your shoulders, noticing for any unevenness or anything like that. I'm going to palpate, noting any crepitus or areas of tenderness or warmth out to your AC joint. I'm going to palpate on your scapula up to your acromion, your coracoid process, your biceps tendon, all the way up your tuberosity there. I'm going to bring your arm back and palpate for your bursa. I'm going to repeat that on this side. I'm going to next do some range of motion exercises. I'm going to have you flex your shoulders forward by bringing them up and up over your head. Extend your arms back. Good. We're going to abduct your arms to go out and bring them up and all the way down. We're going to adduct by bringing them across there. Good. And then inversion. Touch your scapula. Good. And then external, or that was internal rotation. External rotation, just bring your shoulders up and down. Does any of that hurt?
No.
Okay, we're going to test some strength. I'm going to have you just shrug your shoulders up against my hands. Excellent. And then I'm going to have you bring your arms out, thumbs down. Don't let me push down. Okay. Then thumbs up and then go ahead and push out against my hands. Okay, next we're going to inspect your elbows. Again, noting any areas of redness or swelling. I'm going to palpate for crepitus, areas of warmth on your olecranon process and your epicondyles. I'm going to do the same on the other side here. Good. Now palpate your brachial pulses and your epitrochlear lymph nodes. Good. I'm going to just have you kind of bend your elbows up and down. Good. Just do that again. Good. And then I'm going to have you keep your elbows at 90 degrees, and I'm going to have you put your palms up and then just turn them down and back up. Excellent. We're going to test some strength. I'm going to have you hold on to my hand here. Don't let me pull. Don't let me push. Let me pull. Don't let me push. Good. Next, I'm going to undo your hands. I'm going to feel your radial pulses. I'm going to then inspect your hands and your palms. Good. I'm going to then palpate your radius and ulna down to your snuff box, your carpal bones, your metacarpals. I'm I'm going to push on them for bogginess, feeling each joint. I'm going to feel each of your PIP joints and your DIP joints. I'm just going to move your fingers up and down. Good. Do the same over here. Okay, we're going to do some range of motion then, so I'm going to have you with your hands up. I'm just going to have you bring your wrists up and down like that, and then with your hands this way, we're just going to go in and out. Good. Next we're going to test strength. If you can put your arms out in front of you with your wrists up, don't let me push down, and can you put your wrist down, don't let me push up. Give my fingers a squeeze. Okay, yeah, keep squeezing. Good. And then maybe you put your fingers out, don't let me push your fingers in. Okay, and then flip your palms, touch, there you go. Don't let me pull out. Okay, before we sit down or lie down, I'm going to have you uncross your legs. I'm going to have you do extend your knees out here. Good. And that leg. Good. And then, yep, in and out like that for internal and external rotation. Any pain there?
No.
Okay. Go ahead and lie back for me. I'm going to start by examining your lower extremities. I'm going to keep you covered here, but just bring up a little bit. I'm going to just kind of feel for tone of your legs. Just relax. Good. Any areas of atrophy. I'm going to inspect the color and the temperature of your legs. The hair distribution and for any edema. I'm going to check your cap refill of your toes. And I'm going to palpate your pulses, starting with your femoral pulses. Okay. I'm going to have you kind of just relax your knee here. I'm going to palpate your popliteal pulses and palpate for your popliteal lymph nodes. I'm going to do the same over here. Relax that leg. Good. And your popliteal lymph nodes. I'm going to feel for your PT pulses and your DP pulses. Okay, good. We're going to start by inspecting your hip. I'm going to, again, note any asymmetry or unstableness of your hip joints, any redness, pain, or crepitus. I'm going to start with your iliac crest. Palpate down to your anterior superior iliac spine. I'm going to palpate over to your greater trochanter of your femur there. Then we're going to do some range of motion. So I'm going to put my arm underneath you here, and I'm going to have you bring one leg up at a time and squeeze your thigh into your abdomen. Okay, good. And can you do the other one? Okay, good. We're going to test external rotation. I'm going to bring your leg out and down. Good. Then we're going to do some abduction and adduction, and then internal and external rotation. Good. Same over here. Bring your leg out and down. Okay, and I'm going to test for adduction and abduction, internal and external rotation. Good. I'm going to do some strength tests here with your hips. I'm going to have you push up against my hands. Okay, and then lift up and push down. Okay, same with this side. Okay, good. Push out against my hands. Bring in. Okay, good. We're now going to inspect your knees. Again, any swelling, redness. I'm going to palpate your suprapatellar pouch. Good. Why don't you bend your knees for me? I'm going to note the hollows of your knee. I'm going to palpate the tibiofemoral joint outward, your menisci, your patella, your lateral and medial ligaments, and your lateral and medial compartments. Do the same on this knee. Okay, we already did range of motion while you were sitting up, but we're going to do some strength tests. So I'm going to have you just try to straighten your leg. Good. And bring your leg down. Good. And the same thing. Go ahead and straighten your leg out. Good. And pull your leg down. Okay, good. Go ahead and straighten your legs for me. Okay. We are now going to inspect your feet. Just going to take a look at them, notice any abnormal movements. I'm going to look at the color of your feet, any areas of trauma. I'm going to palpate your tibia, fibula, your malleolus, your Achilles tendon, your calcaneus, your tarsal bones, your MTPs. Each joint, I'm going to push on them for bogginess. I'm going to feel in between each of them. Good. And I'm just going to look at the bottom of your foot, move your toes up and down there. Good. And then I'm going to do the same on this side. Okay, and then I'm going to have you bring your toes upward towards you and down. Okay, good. And I'm just going to check for inversion and eversion. Good. And then we're going to do some strength testing. I'm going to have you push on my hands. Bring your toes towards your nose. Don't let me pull. Okay, great. Next I'm going to inspect your abdomen. I'm going to look the contour, the shape, the symmetry, your umbilicus. Can you lift your head up? Give me a call, noting for any herniations. I'm then going to auscultate with the diaphragm of my stethoscope, all 4 quadrants here. Good. And then with the bell of my stethoscope, I'm going to assess for any bruits, the aortic bruit, renal bruits, iliac bruits, and femoral bruits. Next, gonna percuss your abdomen in all 4 quadrants and down until I hear your bladder. Okay, I'm gonna percuss your liver by going up first. And your spleen. Take a breath in for me. Okay, go ahead and breathe out. I'm then going to palpate lightly in each quadrant and over your bladder for any distension or tenderness. I'm going to palpate your aortic for any pulsations or thrills. I'm going to try to feel it if I can. And then deep palpate your abdomen. Just try to relax, take some deep breaths for me. I'm going to palpate your liver. Again, take a deep breath in and out. Good. And I'm going to do your spleen over here. Good. And breathe out. Excellent. All right, I'm going to help you sit up here. Go ahead and stand for me. We're going to test range of motion of your spine. I'm just going to notice again your body position and your gait here. Why don't you go ahead and touch your toes for me. We're going to flex your spine. Can you come forward just a little bit? Good. And then extend. Good. We're going to rotate your spine, keeping your hips forward. Good. And then tilt to one side. Checking lateral rotation. Good. I'm going to have you then start back there. And I'm just going to watch you walk normally a few steps. And turn around and walk back on your toes. And again on your heels. Okay, good. Now I'm going to have you face me. I'm going to have you close your eyes with your feet together, and I'm just going to watch your movements, watch for any swaying or abnormal movements. I would do this typically for 30 to 60 seconds. All right, that is it. You can go ahead and sit. Do you have any questions?
No.
All right, that is the end of your exam then. I'm just going to wash my hands before I leave. Thank you.